Hello everyone, welcome to James Street South. Today we are here with Young Lives versus Cancer. We are meeting this fabulous young lady, Caoimhe, and we're going to hear all about her story and her cancer journey. So Caoimhe, welcome to our kitchen.
Thank you for having me.
What are we making today?
We are making some lovely and simple oatmeal raisin cookies this morning.
Simple. Happy about that. So I know that you had leukemia as a child. So tell us about that. What age were you, etc.?
Yeah, so I was diagnosed initially at age 12 on Friday the 13th. So not the luckiest of days for me. So I was in the Children's Hospital in Belfast, went through treatment there, and the initial treatment for that is a good couple of years. I'd been having leg pain, some really severe leg pain. We went to the doctor and he said it was growing pains. He offhandedly just said to my mum, you know, she actually looks a bit pale on it. Yeah. So sent me for a blood test, and literally that evening got the call, tomorrow morning you need to come down because we need to see you. So it's a blessing in a way because you're not waiting. You know, you hear of all these waiting times for certain cancers and stuff that are just take so long to diagnose because they're just waiting for weeks and weeks and weeks, and it's, you know, kind of, at least with blood cancers, you're kind of in the next day they've kind of got a good grip on it.
I'm not sure if you felt the same way because the first cancer I was diagnosed with, Hodgkin's lymphoma, that was also a blood cancer. Yeah. And for me, whenever I knew that it was my blood that was the issue, I was like, hold on a second, my blood is everywhere through my body and something's clearly not right. I actually thought that maybe my body just wasn't working properly and that this was going to be a continuous thing. So their worry was that it was going to go into my bone marrow. And then you go down the route of bone marrow transplant. And do you know what? Actually, I was in hospital having my second chemotherapy, and the girl in the little room beside me was having it was either a stem cell transplant or a bone marrow transplant. And I'm not joking, you could hear the pain that she was going through. So I was sitting there and I was like, right, game face on, because if these results come back and they're not what I want, then there's not a lot you can do. You just have to, it's like you just have to fight it, don't you? Yeah,
well with my second one, when I relapsed then at age 18, and then you're into adult services, and there's no intensification, consolidation, maintenance therapy. It's straight, you're on the path to bone marrow transplant.
So whenever you were diagnosed, whenever you were 12 years old, what was your treatment plan? It's not chemo, is it?
It is. Yeah. It's pretty exclusively chemo for leukemia.
That shows how much I know about leukemia.
So for children at least, you're talking about something called, first of all, you have an intensification phase. So basically, I was initially an inpatient in hospital for 3 weeks. And then you have consolidation. So it's not as intense, but it's still some chemo. And then you have maintenance therapy, which is very low dose chemo. And then you're probably gonna have a couple of cycles of that. So I had 2 cycles altogether. The second one I didn't have to be an inpatient for the intensification, which was nice. I got to do it outpatient style, and then after your cycles, you're then on maintenance therapy for a year and a half. At the time, it was a year and a half for girls, but it was 2.5 years for boys.
Give us time.
I think there's something about their risk factor.
Yeah, with me, whenever I was going through my experience, I found that, I know you were quite young when it happened to you, in my head, I was just like, right, let's get on with this. But I didn't realise how much it was actually going to affect my family and friends. With you being so young and also relapsing, how was your family? Like, how did they find it?
We've had some conversations about that sort of stuff, and I think without telling each other, we took our cues of how to react to the situation from each other.
I understand completely.
So they were kind of, okay, well, how do we fix this? You know, there's no use crying over spilled milk. You know, the diagnosis is there. And then they then kind of took that from me, because then I was kind of like, well, only thing you've got to do is just get through it. You know, there's nothing else you can be doing.
I think it definitely brings a lot of people closer together whenever they're having to go through something as life-changing as that.
Yeah.
So right now, what are we doing with... So what ingredients do we have in there?
We have sugar, butter, egg, and some vanilla essence.
And you have to pinch to see if it's grainy or not, isn't that right?
Yeah. So generally, if you were making something like a cake, you would be looking to get a really smooth texture, because the ratio of your ingredients is pretty much 1-to-1.
Yeah.
But because here we've got a lot more sugar than we have anything else, we're just looking to get it well
just all mixed
integrated.
Together.
Yeah. You're never going to get it completely smooth, but as smooth as you can.
Smooth as you can.
Smooth as you can.
So tell me what you're doing now. So you were diagnosed whenever you were 18. You were re-diagnosed whenever you were 18.
Yeah.
And I hear that you have a career path that you're on right now. Tell us a little bit about that.
Yeah, so I'm currently a third-year student nurse.
Wow.
With Queen's. I like to say that so institutionalized by the hospital that I went back to ask for a job. So the experiences from that has helped me, because you know, I kind of know on a patient level how they're feeling, and
yeah, of course.
You know,
there's an empathy there that you can bring, and you've been through all these experiences, and that is just going to filter right through into your career. I think it's incredible, to be honest. I think all the doctors and nurses in the hospitals are absolute heroes, especially with the year that we've had.
Oh yeah.
With COVID, and I just think it's going to be great for you. I think you're going to love it. Are you enjoying it so far?
I am, yeah. It's I think what kind of helps me get through anyway is kind of knowing at the end of the day I get to go home, but they don't. You know, you still have patients still have to be there.
Yeah.
You know, and so kind of when someone's being difficult or you're having a long day, it's kind of hard to remember that, but thinking about that does help.
Yeah, you definitely will have a lot of empathy there.
And it's nice to be able to get out of the house.
For sure, definitely.
So it is.
Did you always want to be a nurse, or was it something that after you went through your experiences with cancer, you were like, you know what, this is what I want to do with my life?
I wanted to be, after my first diagnosis, I wanted to be a pediatrician, obviously just because of my experience. And then I started getting into drama and stuff in fourth and fifth year. So then I kind of changed path. I wanted to do acting then. And then after, obviously didn't go to university when everyone else was going, and after a couple of years I went to London to do a gap year course.
Wow.
Which is basically like a course that was kind of like every weekend, and basically like you're getting a little taste of it. You know, going to drama school, do you really want to spend like 27 grand on this? And then I got there, and like by the second weekend I was like, no. I got a job in NHS England as an admin, and the office I was in was doing some really cool work at the time. And I thought, well, this is actually really, really interesting, but I would kind of want to be on the front lines. My A-levels weren't great and all that, because I was kind of sick without knowing I was sick for like the months beforehand. But I came back home, I did an access course in the Belfast Met, and that kind of got me enough then get into Queen's to start nursing.
Amazing. And tell me this, it's purely for my own curiosity.
Yeah.
I have quite recently got cleared of both of my cancers, both thyroid cancer and Hodgkin's lymphoma. Does it get easier as time goes on? Because one thing that I really struggle with is fatigue. And I know that a lot of other cancer patients, whenever your body's going through something that's so chaotic almost, like all the treatment, all the surgeries, whatever treatment you have to do, one thing that I just really struggle with is sometimes getting up in the morning, you know?
Yeah, and yes, in terms of the physical stuff, it gets better. I mean, I know after my bone marrow transplant, I think I threw up every single day from the 19th of January to mid-July.
Oh my goodness.
Just because of the way you're feeling, and you feel crap, but all that physical stuff passes, but it passes in such a way that you don't even realize until like 2 months later. You're like, oh my God, like I haven't felt that, you know, I haven't felt bad in a long time. I feel really, really good. Mentally, I think some stuff always stays with you. I mean, I know every time I go for a checkup, doesn't matter if it's, you know, every checkup every 3 weeks, every 6 months, every, you know, whatever. It doesn't leave you, but you kind of know to check in with yourself, you know, and be like, okay, well, how am I feeling about this? Is this, you know, sometimes I don't know if this is like a good way to do it, but I would go to the NHS website and type in leukemia.
Yeah.
And they have like a list of symptoms.
Oh,
and then
I did as well.
No, but then I can be like, okay, I don't have that. I don't have that. I don't have, you know, you can be like, okay, I don't have any of those things. This is probably not that. But then, you know, you get the letter in the post that you're up for your checkup, and that whole day, like, you know, you can't eat, you can't drink, you can't, because you're just worried. But over time, you don't feel that all the time.
Yeah.
Is what I'm saying.
Did you feel that your mental health was affected by going through it, especially the second time, because you would have been a little bit older, even maybe even the first time as well?
Oh yeah, definitely. I don't even think I realized it until my mum said something to me. She's like, you just need to be aware that someday you're gonna hit a wall, and it could be tomorrow, it could be in a year, it could be on your wedding day, you know, it could be 20 years from now, but one day you're gonna wake up and be like, this happened?
Everything's so fast, I feel, whenever you're going through things, and it isn't until afterwards. I'll be honest, I actually don't even think I've properly dealt with everything that I've been through.
Yeah.
I think it's definitely a process.
My coping mechanism is to kind of retreat back. I don't kind of involve anyone in...
you go into yourself a wee bit?
Go into myself, I'll be like, you know, family and friends, right, we'll see you in 6 months, you know, because it's not going to be me for a while. I mean that's how I get through it. I don't think that's necessarily the worst thing in the world, but the problem is that you can't be like that all the time, because eventually that sort of way will not be benefiting you anymore, and will kind of turn against you. I had a really bad time like a couple of years ago, and like by this stage I was a couple of years out even of the bone marrow transplant, and you know, I had to go on antidepressants and was talking to someone, but actually she's like, all your coping mechanisms are generally pretty okay, it's just you've overused them, so now they're not actually
as
working
effective
for you anymore. That, you know, they've kind of mutated and are working against you.
It was something that I really struggled with whenever I was going through it. Whenever you mentioned there about kind of telling everyone, oh yeah, I'll see you in 6 months. If it was ever to happen to me again, I feel like that's probably what I would be like, because knowing what it was like the first time, I don't want my friends or my family to see me like that. Maybe that isn't the right mindset, but I think the thing to remember is, especially even talking to myself, is that everyone's different, everyone's journey is different, everyone deals with things in different ways. Yeah. But at some point or another, you need your loved ones around you to give you that support, you know, to pick you up whenever you don't feel like you can do it yourself.
Yeah. No, I would definitely be trying to protect my family, let them know kind of how you're feeling.
Yeah. So when was your last checkup?
February last year.
And did that go well?
Yeah. It went well, and then it was really funny. I got a shielding letter.
Oh, did you?
In July, yeah. I think just because hematology keeps a really,
they keep a close eye on us.
Close eye on you,
Definitely.
yeah.
I actually had an appointment during the week there. I'd been having some different issues with my chest, where my Hodgkin's lymphoma once was, and so I had a CT scan on Thursday and got the results on Friday morning. That it was all clear.
Good. Congrats.
You probably understand how much of a relief it is.
Yeah.
Knowing that it's not there, but you've also had the flip side of that where you've relapsed, which is something that a lot of other people luckily haven't experienced, but also it's so good that you have that experience so that anyone else who's possibly going to go through that, you can help because you've done it.
Yeah, I think relapse is a really big worry. You know, there is a part of you that's like,
I know. You just don't feel right.
I really think it's this. Oddly enough, then when you get the diagnosis, it doesn't come as much of a shock.
Yeah, I understand.
You know,
that totally.
so while to my mum and dad it might have been, I was able to be like, okay, this is.
You already have like a roadmap in your head of what you're going to do.
Time to kind of, you need to step back up to the plate. You know, you're on again. You know what you got to do.
So whenever you were going through treatment, did you do a lot of baking? Or what did you do to keep yourself occupied? Because I really struggled to keep my mind occupied.
Well, treatment for leukemia is different because you're in hospital, so you can't really be doing much of anything, really. TV, probably. I had the schedule pretty much down. I think it was Judge Judy at 7 a.m.
I would have put on Jeremy Kyle.
Well, came in one day and it just finished this morning, and I don't really like those sorts of shows, but there's nothing else on at that time. But then all like your Come Down With Me's and stuff start on one channel, but I hadn't turned it over and gone on to Loose Women, and the consultant came in and he just looked at me. He's like, "You're not watching that, are you?" I'm like, no, I promise you, I'm watching educational shows.
I tell you what, see the amount of TV I watched.
Yeah.
I don't even know why, because I wasn't even listening to it half the time because I couldn't concentrate. I couldn't even read.
No. I think we could roll this up, but I'm just trying to get my hands as un-OD as possible so I can grease these trays.
Would you like? Hey, do you want to pass them down to me and I'll grease them for you?
Yeah. Just if you're happy with it. I don't want to mess up the lovely.
Just watch your shoes.
I know, and it's such like a lovely floor, and it's.
I think I can't actually stop glancing down at the shoes. They're so beautiful. You've got to show us the shoes.
Yeah,
Bring them out and show them.
I can have a.
Look how gorgeous they are.
I know, they're my. I had them a while. They're one of my.
Hand me those down. And I'll get stuck in.
We grease for them. Thank you so much, Mia.
No worries. So do I need greaseproof paper, or am I just rubbing this butter all over this?
Just rub the butter on them. Should be fine. Be fine. But sure.
We'll have a go. But yeah, I watched some serious amount of TV while I was going through treatment.
Yeah.
But do you know one thing I struggled with, and I'm not sure if you were similar, maybe whenever your second diagnosis, it was really hard for me to do nothing sometimes because my life before was so busy all the time. So I felt like my life was just passing me by. Yeah. Especially if I was sitting watching TV all day, you know?
You kind of feel like I need to kind of get up and do something, but you can't really get up and do something because you're not feeling.
I know.
You know, and then unfortunately I kind of then got into the habit of doing nothing.
Yeah.
It's then like flipped over. It's harder to be.
Yeah. Do you know what, Kiva?
Productive.
Do you know what? I honestly can't tell you how lovely it is chatting to you.
Yeah.
Because I haven't really had the experience of chatting to many people unless it's been online.
Yeah.
About their experiences, and chatting to someone who's like totally gets it. I'm just like, this is so amazing.
No, it is really nice because you're just like, no. And
unless you've been through it, you're not going to understand. And it was one thing, like my dad and my brother, and they would try to understand.
Yeah.
But they just couldn't. They couldn't, not fully, because fatigue, whenever it comes to chemotherapy, the metallic taste in your mouth, the aches and the pains, there's nothing that can really compare to it unless you've been through it.
Yeah, and I was very lucky in the sense that a lot of my stuff, like the worst thing that happened to me, generally would have been fatigue, just generally feeling unwell. You know, I was very lucky to kind of get through without a lot of complications. But
did you lose your hair?
Oh yeah, twice. Yeah, but for me, I was oddly very like, it's only hair. It oddly enough, it wasn't that important to me. Yeah. Then when it goes back, you're like, oh, I forgot how lovely this was.
I forgot I had hair.
I forgot I had hair. This was, you know, and it's like when you start getting like a wee shadow just like across your hairline. Yeah. It just starts coming in and it's really fluffy. It's like downy hair. And you're like, oh, it's coming back. And like every day you're like, oh, there's a shadow. And like you're like, mom and dad were like, all right.
Do you know what? There was a stage I got to and I was like flipping doing everything. I used hair bands just to kind of try to hide things whenever I was really, really sick. The hair was so thin at the time. And I remember getting out of the shower one day and just, it was almost like an overnight thing that I was like, it looks like hair again. Yeah. The texture changes. It goes from being like bristly to looking like hair again. Yeah. And that's when it starts to get exciting.
Definitely. I was like, 'cause I never really got into like the wigs or anything just because they really just annoyed my head. And I was like, I'm not doing this palaver, you know, every morning and night of. So like the hats were pretty much it for me, but I wouldn't take the hats off even in the house. I wouldn't really have taken them off. And I would have a hat that I would just wear like probably until it was, you know, ribbons. Like I went in one time for a checkup. This was the first time around with the doctor, and he said, "Still got that tea cozy on your head?" And I was like, all right, I guess it's time to change the hat then. All of my doctors have been kind of pretty straight talking, and I get that's not for everybody, but I really like that because it's like, just.
My consultants were actually the same, and you know what? I really appreciated it because whenever I was first getting diagnosed about 15 months ago, initially there was quite a lot of beating around the bush before I actually got to the cancer doctors, before they really knew what it was, and it was actually a nurse. I just asked the nurse straight, like, do I have cancer here? What am I working with?
Is that what they're saying? Yeah.
Yeah, they were kind of beating around the cancer word, if that's the thing.
They didn't really want to say it.
I was by myself and they didn't want to scare me, I think. Yeah. They were kind of going to wait until my family were there, but yeah, scary experience altogether. But I honestly admire you so much for going through that twice.
Oh, thank you.
I really do. And I'll tell you what, touch wood, where's wood? If it ever happens to me again, I'll be coming straight to you.
Oh yeah, absolutely.
For sure.
Absolutely. There's I know I tell this right as like a funny story, but like people are a little horrified when they hear it. But before a bone marrow transplant, you have to have like a talk with the doctor because obviously it's a very risky procedure just because of basically they're eradicating your entire immune system. So you get high dose chemo, high dose radiotherapy, everything's just completely broken down. Yeah. So that then they can rebuild it. So they have to have a talk with you and be like, these are the risks. This is what's going to happen to you. My consultant her opening sentence was 10% of people die from this procedure, and I thought it was really funny because I was like, fair enough, you're not really mincing your words there, are you, doc?
Oh my goodness.
And people are like, I can't believe they said that. I'm like, nah, it's all right, you know. You're going to have to hear it at some point. So
it's maybe a little bit more of a personal question, but it's something that definitely crossed my mind, and I know that it's something that's crossed other people's minds as well. The fear of death. The fear of that actually happening, especially hearing that from a doctor saying like 10% of people will die here. How did you cope with that?
I didn't. I don't think about it. It's probably, but it's my personality anyway. From as little as I can remember, it's always been a huge existential fear of mine. But like the only way I have ever found that I can cope with it is to when that thought comes into my head, you know, it's like, but it's just like, what's there? Like, you know, you start spiraling. Is for me to go, no, it's not important. It's not necessary.
I almost count every day as a blessing now, because I was in a really bad way whenever I was diagnosed, and another couple of weeks, another month or two, and if I hadn't have caught it, then it would have been bad news. But for me now, I'm just sort of like, do you know what? You just need to live each day as it comes. Enjoy the good that you do have on this
day
earth.
at a time, for sure. The nursing has actually helped me see, because you see patients in palliative conditions who are at the end of their life, or who maybe, die.
Yeah.
And it really, it drives it home.
Yeah.
A little bit more.
Let's get the first ones in the oven then, shall we?
Yes. First one's in the oven. That's fine. Sorry, my hands are so oaty and sticky.
Well, don't worry too much, because
okay. I just need to get them relatively, if I can.
Here, considering they actually look quite good.
I know. Well, let's hope a bit of time in the oven.
Bake off, I'm coming for you. Amazing.
So,
fabulous.
15
so how long
minutes.
are they get into the oven for? 15 minutes?
15 minutes, yeah.
Great.
15 minutes, and we'll see how they look.
So the cookies have now been in the oven for 15 minutes, so we're going to get them out and see how they look. Oh, they look amazing.
I know, and the smell.
Oh, you can't beat freshly baked cookies.
Absolutely
you
not.
can't beat it. You are currently doing the Move Forward program, isn't it?
Yeah, I think it's probably the best things I probably have done for myself. It started, I think 4 years ago? In the hospital, I wouldn't have ever involved myself. But when I got out, I wanted to be a part of something, and like literally anything, even to this day, doing this, anything that anyone offered me to do, I was like, yep, I'll do it, just to be part of it. And I would never have exercised or anything beforehand, but it's just become like a non-negotiable for me. And even if I'm having a really crap day and it's 7:30 and I'm still in like the jammies and stuff, it's like, oh, well, I gotta get up because I gotta drive over. I have to go because I've already said I'll go tonight. And you see, once you come out of there, you're like, forgot that you even had a bad day. Bad day in the first. No, it's been amazing. It's been really, really good. Yeah.
Do you know what, Caoimhe? I have absolutely loved chatting to you today. It's so lovely to get an insight of someone else who's been through something similar to me, and it's been a pleasure to chat to you.
It's been a pleasure.
And I am so excited to go to Move Forward with you. And
oh, absolutely.
I need to start going.
Yes.
For sure. But thank you so much.
Thank you very much. Thank you.
No bother.